everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing another benzodiazepine known as Oxazepam. Its brand name is Serax. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So oxazepam belongs to a chemical series of compounds known as hydroxybenzodiazepinones, which exert immediate action on disorders associated with anxiety, tension, agitation, as well as irritability. They would also have an immediate action treating anxiety associated with depression. There are two official indications for oxazepam. One would be to treat alcohol withdrawal syndrome, and the other would be to treat anxiety. Now, before somebody was to use oxazepam or Serax, there are some contraindications as well as precautions and warnings that they should be made aware of. In terms of contraindications, it can't be used in individuals who have a hypersensitivity to oxazepam, as well as patients who are experiencing psychosis. In terms of precautions, this medication does fall on the Beers criteria, which is a list of medications which the elderly population should either avoid or use very cautiously. This medication would put this group of individuals at an increased risk of cognitive impairment, which could even lead to delirium. Falls, fractures, as well as motor vehicle accidents would be a concern with this group as well. However, there are some off-label uses for oxazepam, such as treatment of seizures, as well as the treatment of rapid eye movement disorders, where this population, again the elderly population, can use this medication if a physician so chooses. There is a risk of withdrawal syndromes if somebody discontinues this medication abruptly, so a gradual dose reduction is always recommended. Some patients have become dependent on this medication, so it's a good idea to avoid this medication in patients who have a history of drug abuse. As a patient's age rises, they would be at an increased risk of hypotension, paradoxal excitement, or sedation. It should be noted that opioid addiction medications, such as buprenorphine as well as methadone, should not be denied to patients if they've used a benzodiazepine. Using these medications would put the patient at a risk of having serious side effects. However, not receiving those medications may be worse for the patient. This is when the clinical judgment of the pharmacist as well as the physician would come into play, and oftentimes they would communicate before a dose of one of those medications is given. The use of this medication in women who are pregnant could result in birth defects, especially in the first trimester, so we don't use this medication in pregnant females during that first trimester. Now, once somebody has cleared the contraindications and are made aware of the precautions and warnings, and they start using oxazepam, they can expect to take this medication in tablet form. It's available as a 10, a 15, as well as a 30 milligram tablet. If somebody was using oxazepam to treat alcohol withdrawal syndrome, they would use typically 15 to 30 milligrams 3 or 4 times daily. When treating mild or moderate anxiety, 10 or 15 milligrams 3 or 4 times daily would be appropriate. In severe anxiety, 15 or 30 milligrams may be required 3 or 4 times daily. Although it's not an official indication, if somebody was using this medication for sleep at bedtime, they would take 15 milligrams typically before they get in bed. Now, as with all medications, there are some adverse reactions or side effects that patients may experience while using oxazepam, so I'll list some of those off here for you now. Dizziness, headache, somnolence, as well as vertigo has been reported. Paradoxal reactions such as excitement as well as stimulation of affect have been noted in psychiatric patients. These side effects, if they were to occur, would typically arise in the first 2 weeks of therapy, and it's thought that this may be due to the decrease in anxiety that these patients experience. Leukopenia would be a rare but serious side effect associated with oxazepam, and there is that risk that we talked about earlier of having withdrawal symptoms if you stop the medication too abruptly. That's all we're going to talk about today with oxazepam or Serax. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you're willing to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. All right, that's it for today. Take care.